Let me get all this for you. Have you filled out your tests? You can do all this online. But if you need help with paperwork, then make sure I've got my safety things up in place. Through social distancing, doctors have been able to treat a lot more patients. So instead of going out to get checked if you are, whether or not you are feeling ill, then, definitely get checked out, for sure. But, there are steps and procedures, and, if you're ever having a hard time, always call a cab if you can't get the ambulances. And here is a quick read through. And I've been trained first aid life giver since, in 2011. You have to renew those every year. And I'm not a licensed practitioner anymore. But consult with your nearest trained medical practice for any health issues that you may have or any health questions. And always call first, rather than go down and be told to go back home. Because sometimes volume can't hold that many people, and you've seen waiting rooms. So just call. Common signs for coronavirus are fever, a new cough. So it's like if you're starting to get cough for no other reason, then check that out. Shortness of breath, difficulty breathing. In most severe cases, infection causes pneumonia and rarely death in the worst cases. How it spreads is primarily from person to person through coughing and sneezing, and it's just like the common cold or flu, and all these variations as it's progressed, and that's through your spit and saliva. So masks up, right? Prevention steps: stay home if you're sick. Return to work or school when you're well, if you're part of the essential services. Wash your hands often using soap and water, or use your hand sanitizers, whatever it is. Practice good hygiene. That's good for your health in any case. Avoid touching your eyes, nose, or mouth. Your ears, wash those too. Unwashed hands, don't touch stuff. Cover your face when you're sneezing or coughing with your tissues or your hanky, right? These are reusable, and you can well, maybe not if you are sick, but certainly keep your distance. And we've got the look up for your updates online. Avoid shaking hands. Don't even fist bump no more. Avoid sharing your personal items like toothbrushes, which you can get at Walmart. Speaking of, they are providing a lot of materials for making masks, and the clothing that we see our healthcare workers using to help prevent the spread. So stop hoarding that stuff because they really need lots of it. Clean and disinfect everything. Disinfect your high-touch surfaces daily, and that's not your up tops. Well, clean those, but that means your doorknobs. I don't know if you can see mine down here, but I put something over mine, so that just reduces how often that spot gets touched, and then that can be something that that you later wash, right? Clean and disinfect. Use your disinfectant properly. If you're experiencing any of the symptoms, call the health line. I'm not a practitioner, they are. I have a link for Folding Gate, which is part of this supercomputer that is researching this virus. And if you want to help, and you have like a pretty good hard drive, we've got folding software that will hook you up. You could be a sidekick to this supercomputer, and we can all help combat this COVID-19. Speaking of protecting and preventing, we've got those masks for personal use. Use this just to be safe and careful, because you don't want anything to get into you through the most accessible areas, right? So I know a lot of people like to wear shades now, so that's not only fashionable, that is possibly life-saving. So yeah, save the stuff for if you have stockpiles. You know, the hospitals would love you forever. Well, as it depends on how many you have. And yeah, Canada and U.S. We are both doing everything we can to join this world in slowing and finding a way to help everyone. That's clothing from Canada, from our scrubs and our masks for those intake workers, and first responders, and you know, everyone is using that. And we have respirators for patients from the U.S., and those are being stockpiled, and distribution. That's part of negotiations underway. Mexico update there. So if anyone cared about where this virus is going to, then April 3rd, which was yesterday, from where I'm recording, and that was their first case that was detected. So be on the alert, and Mexico really needs to step up their precautions. No matter how they do it, just slow this down, because, well, no matter how they do it. Proper health care is important for the entire world. So let's all work together to get all of our workers that are still out there working, so that everybody can survive. Get them some help, whatever you have to help them. Even if that is just getting online and helping this social network build, because that's really doing a great job to help all of these efforts. In future, for more healthcare related topics, we might be getting into anxiety and ways of coping, and possibly other mental health issues. But not specific advice from me, but I will be getting advice from others to put into here to help the things that should be highlighted the most, I think, or they think. Stay safe, and keep social, no matter what you're doing. Stay in touch with the rest of us, because everyone's worried about everyone else right now. Don't stop that trend.